Let's talk about foreign bodies in the eye. You know, everybody gets a speck of dirt. Can that be an emergency, or does somebody get bigger specks in the eye, or somebody gets a splinter in their eye? Tell me about foreign bodies in the eye.
So, foreign body in the eye is one of the most common things that we see as far as traumas in the clinic. It really comes down to how did it get in there, and what do you think it is? For example, let's say it's a windy day and something is just blowing around and you feel something get in your eye. Most likely that's not an emergency. You're going to blink that out and you're going to be fine.
Is it dangerous ever to pull your upper eyelid over your lower eyelid and let that sort of brush it away?
I think that's fine. You're just trying to get the tears to flow, and your body can wash that sort of thing out.
If you keep blinking and you know something really is wrong, what do you think of then if they didn't wash the dirt out?
Well, I mean, eventually, if you still have the symptom, obviously go be seen.
So when you're seen, what does the doctor look for? A scratch in the cornea for the foreign body? What do you see, and how do you see it?
So we're looking at you mentioned the slit lamp microscope. So we're looking through the little microscope under some high magnification, and we're looking for exactly that. Is there a foreign body in there? Is there something in there? Sometimes we actually have to flip the eyelid, the upper eyelid, inside out. Sometimes the lid gets...
How do you flip that?
Well, here, come over here, I'll show you. No, I'm just joking. So basically, we just have a patient look down, and then either with our finger or with an instrument, we just kind of push in and flip the inside of the upper lid so it's actually showing. So
you can sometimes see a foreign body that way, and you remove it with special equipment or a cotton swab or what?
Usually cotton swab, something like that.
Again, it depends on what the foreign body is. Tell me about the importance of preventing something getting in your eye.
Yeah, so here's where we're talking about, you know, I'm going to go, I've got a little some grinding to do over here. And then, or I've got to go do some weed whacking. You know, I've got yard work to do. I'm going to go mow, or I'm going to be working on my hedges.
Yeah, and it's not going to bother my eyes.
And it's just going to take a minute. It's no big deal. I'm going to run over there. Well, that's when the problems happen. And so, especially things that get in the eye under a high velocity. So for example, if you're using a weed whacker, please use
protective eye.
You know, same thing if you're grinding metal on metal, or if you're, I tell you a very dangerous thing is as a hammer striking a nail. And so that can cause a projectile. And usually those little pieces of metal are very sharp, and that can actually penetrate inside the eye and require a major surgery to remove.
So protect your eyes with eye goggles.
Yes.
Think and take the time. You don't have to get something done in a minute. A stitch in time saves 9,
yes, sir.
As we say. Any other thing in eye emergencies, an overview?
I mean, I think we've hit the main things. The main thing is, you know, be careful, especially with, you know, when you're working around the house. I have gotten stuff in my own eye thinking, oh, I'm just going to spray a little lubricant on this. And then it gets in your eye. And my first thought is, you big dummy, why didn't you have some glasses on? And so it's important. So even for the little things, make sure you put on some eye protection. And if something gets in there, be seen. Same thing with any kind of chemical or loss of vision. The key is be seen.